Beyond the Pelvis is hosted by Dr. Keneal Siegel, a pelvic floor PT and intuitive healer, and Laura Haraka, a somatic practitioner and breathwork facilitator. Each week, we explore alternative and holistic approaches to healing chronic pelvic pain and other painful or chronic conditions. Join us and other experts in mind, body, and spiritual healing as we discuss a wealth of modalities ranging from ancient practices to modern therapies that challenge the conventional Western model of treatment. Let's get right to it. Welcome back to another episode of Beyond the Pelvis. This week, we have a really amazing guest. I say that about all the guests, but this one really is amazing. And I've been looking forward to speaking with her for a really long time. And this is Dr. Brianne Grogan, also known as Dr. Bree. She's a doctor of physical therapy, specializing in pelvic health. She's an Oregon native. She and her family took a 12-year detour to Germany, where she nurtured her popular YouTube channel, which now has over 400,000 subscribers. That is amazing. And today, Dr. Bree is back in her home state and enjoying living, working, walking, hiking, drumming, and dancing. And she's passionate about the mental and emotional aspects of pelvic health. And her mission is to change the conversation around pelvic wellness to a new paradigm that includes thoughts, emotions, energy, mindset, spirit, and soul, along with body-based approaches to care. And all of that summarizes all the good reasons why we wanted to have her on, because pelvic health is more than just the pelvic floor. So, Dr. Bree, welcome.
Thank you so much for having me. When I saw that you were starting a podcast, I was like, oh, maybe I'll get to be on it one day. This would be so exciting. So I'm thrilled to be here.
Yes, and thank you for agreeing to come on. And you were definitely in mind when we started this podcast. So I'm glad you were able to join us.
Yeah, I'm so excited to have you here today. Like I said, I have watched and listened to so many of your meditations and your videos, and you have so much to offer our listeners. So I know that me and Keneal are just really happy that you agreed to share some of your knowledge and wisdom with our audience. So thank you.
Yes. Oh, so excited to chat with you.
So why don't we just start? Maybe you can just share a little bit about yourself, who you are today, and what brought you into this space.
Yeah. So I'm a physical therapist. I graduated with my doctorate in physical therapy in 2006. So it's been a while. And I'm always shocked by the fact that I graduated from physical therapy school so long ago, and a lot has shifted in this world over that time period, the world of pelvic floor physical therapy. But I didn't actually start out in pelvic health. I started out in geriatric physical therapy, and I quickly, through my own pregnancy and postpartum struggles and joys, and also just because of what I was seeing in the skilled nursing facilities I was working at, there was many reasons why I decided, wow, bladder health, incontinence, all of these issues that people are dealing with throughout the lifespan really need to be looked at and worked with. And I'd been, kind of interested in pelvic health in physical therapy school, but didn't dive in until my own pregnancy. So I switched to pelvic health in 2007 and have been in that space ever since. So, oh gosh, I could go into so many aspects of my journey, but I guess we'll start there. And anything you want to ask, I'm here for.
Yeah, I think many of us who end up in the pelvic health space came here because of our own personal experiences, which I shared my personal experience with my own pelvic floor and abdominal dysfunction, which led me into this. I happened to be in school during that time, so it was easy for me to just jump right into this. So I've been in there since, the beginning. And I'm more newer, only graduating in 2016, but even still, like it still feels like it was yesterday, which I imagine it probably feels similar to you, where it was like, oh, that was just yesterday. Nope, that was a while ago.
It sure was. Yeah. And my own issues, I developed a mild bladder prolapse, with my after my son was born. And so that was really what kind of catapulted me into really, really empathizing with my patients and understanding what they were going through. And then over the, last several years, probably the last 5 years or longer than that, really, but that I've noticed within the last several years, I've noticed a lot of issues with pelvic tension in myself. So I think I'm sure this has been a lifelong thing, since constipation has been a lifelong thing for me. There's been all sorts of issues that have really led me to know that this has been a lifelong thing for me, but it's really something that I've had to monitor and manage in myself over the last several years, which has translated really well into the work I do. I mean, so often we teach what we need to learn ourselves, and we are the healers because we've gone through it, as you said. So pelvic organ prolapse and pelvic tension are two of my real loves of helping people with.
It's always our personal journey that brings us to where we're supposed to be. And then we can learn how to help ourselves so we can share that knowledge.
Yeah, exactly.
I
Mhm.
think that's what makes a healer is having gone through the experience personally and then overcome that or overcoming that. Because is there ever really an end to that journey, that healing journey, right? I feel like it's just an ongoing process, but because we're steps ahead, we can still help everyone behind us to sort of meet us where we are and continue to go there together.
Yeah, beautifully said. And that's how I like to look at everything I do. Is I'm not on some pedestal of saying that I know it all. Like this is I'm just one of y'all, I'm just one of you. I'm just like my patients. I'm just like you said, a step ahead perhaps. And I do have quite a bit of background knowledge and education behind me, but we're all in this together and we're all learning together. And it's more of, hey, let me take your hand and let's take this together on the path at the same time, rather than me teaching you as some expert.
Now you mentioned that you've noticed a shift in pelvic health, and I'd like your opinion or feelings or thoughts about that from the time that you got into pelvic floor, pelvic health recovery to where it is now. What have you noticed?
When I first got into pelvic health, definitely there was an emphasis on a thorough examination of the pelvic floor, definitely an emphasis on, of course, the muscles can be hypertonic or there can be too much tension. We need to look at that. However, I do feel that back in 2006, 2007, 2008, when I was really going through the initial coursework, there was more of an emphasis on strengthening and going straight for the strengthening, straight for the isolated pelvic floor strengthening, such as Kegels. And I think that over time, I mean, it's always been part of my approach to integrate the pelvic floor into the rest of the body and integrate the pelvic floor into total body movements, exercises, that kind of thing. And we were taught that. I don't want to throw my training under the bus by any means. It was wonderful training I received. However, I just feel like the paradigm was really talking about Kegel exercises and strengthening and strength work. Whereas, of course, we want to strengthen. However, there's often some first steps that may need to be addressed first, such as releasing. And again, integrating the pelvic floor into total body movements into your lifestyle, not just focusing on some isolated exercises and calling that enough. So I think that more people are talking about that kind of total body, total lifestyle approach now than when I first started in pelvic health. And the other thing I'm seeing is much more of an emphasis on holistic approaches and integrating mind and body and, calming the nervous system, which in so many of us is just hyper aroused, usually contributing to the tension, the pain, some of the issues that we're seeing. So a lot more with nervous system regulation and integrating a whole mind body approach to pelvic care, which is beautiful to see. And I think that there's still a ways to go as far as getting that into the mainstream.
Yeah, I totally agree about there's still a whole lot of ways to go because even today, like I still have individuals reach out saying, I think I need pelvic floor physical therapy, but I've never had a baby. My pelvic floor is not weak. And I'm like, well, yeah, you do. And that's not the only reason why someone would need pelvic floor therapy. And they just happen to, I guess they're just like desperate and they're like, I'm just gonna find out, or I'm gonna just try and see if she can possibly help me. And I'm like, oh my goodness, absolutely, you could benefit from pelvic floor PT because it is more than just the strengthening piece. And I cannot wait for the day when that's not all pelvic floor physical therapy is viewed as.
I agree. And it reminds me what you just shared is very similar to something I was looking at the other day. I was Googling constipation for some reason, something I was working on. And an article came up as like the top hit. And it was from a very reputable looking source. I can't recall what the source was right now, but it was very, reputable looking. It didn't look like something silly that you just dismiss anyway. But it basically said the solution was pelvic floor strengthening. And I was, and it offered Kegels. So of course, strengthening is a great idea, but to just blanket offer Kegel exercises as the solution for constipation, I'm like, whoa, there is so much more to look at here. Nutrition, nervous system, muscles that are hypertonic, too tight, potentially, not necessarily, but potentially. And so I always say, for the most part, it's essential to actually learn how to relax first before we begin strengthening, before we begin contracting and going straight for those Kegels. But this is still the dominant way people are looking at any type of pelvic health issue is, well, just go do some Kegel exercises to build strength, if anything, if it's even looked at.
The reason I love what you do is because you don't just look at the physical component. Now, I'm a big proponent of pelvic floor PTs. I'm a big proponent of doctors. They have their place. But I went for years of pelvic floor PT. But what they were missing is the pieces that you're talking about, not just the body, but the mind and the spirit. And there's such an emotional component to the pelvis. And I was wondering if you wouldn't mind talking about that a little bit.
Oh my gosh, yeah. And to be fair, I mean, a lot of the emotional work, I don't shy away from it. And I know a lot of physical therapists simply don't have the time in their schedule because this stuff is big. It's a big deal. And it's kind of like opening Pandora's box once you start working with someone and talking about emotions, talking about past history, talking about whatever it may be. But it's a big thing. And a lot of people don't have the time in their schedules and don't have the training, the training to know how to deal with it. And also as a culture in general, in our society, again, very blanket statement here, not true for everyone, but in general, we are a society that's afraid to feel, we don't know how to process our emotions. It's just not part of what we do. And so it really is no wonder that it's not part of the mainstream of care. And I think also there's some fear that this is outside of our scope of practice as a physical therapist. Like we don't want to get in trouble for doing something that we shouldn't, in air quotes, be doing. And I get that. I understand that. I totally respect that. I'm not a psychologist. I'm not trained as a psychotherapist. Like that's not my training. However, I want to kind of take a stance here and be like, listen, we're all humans with emotions. Emotions are what make us human, not robots. Like it's part of the human experience to feel. And so, no, I'm not providing psychotherapy with my patients or my people who use my programs and watch my meditations on YouTube. But I am speaking to the human experience of we are humans with emotions, energy in motion, emotion. Like that is what we all deal with. And it's impacting us on a physical level, which is what I do treat, which is what I am trained in as a doctor. So our emotions impact us physically. And yes, I think if you're a person out there, a provider who feels comfortable diving into this world, it is going to benefit your patients and your clients and your friends and yourself so much to look at the emotions and how our emotions impact our physical body. Clearly, I'm passionate about this.
I am as well. And speaking of emotions, you brought up whether it's within our scope of practice, and I questioned myself. Can I do this? Should I be doing this? is this within my scope of practice? Am I going to get in trouble? I'm not a psychologist, right? And it just got to a point where I was like, you know what? It's helping them. I cannot dismiss it, or I cannot compartmentalize and be like, okay, when you're here, we're only going to talk about these things, but anything emotional, can you go talk to your therapist about? Oh, you don't have one? Well, I guess I
Mhm.
can't help you there. So I got to a point where I decided I have to help them in some other way. And if that looks like me asking certain questions or guiding them through meditation or giving them journal prompts, then I'm going to do it, whether it's within my scope or not, because as you said, we're humans. We all have these experiences, and it just needed to be done. And I really hope that the education system, especially our physical therapy education programs, will start to incorporate even more. Because as you know, we do talk about the biopsychosocial model, but for me, that was like a half semester, maybe a 2 week class. Like it was longer than probably some people get, but still, there wasn't really much more. We never talked about emotions. That's not our scope of practice. Refer them to someone. And then it turns out we can do these things. We can talk about it. I just completed a training in hypnotherapy. They allowed me to do it and I can practice it, right? It looks a lot like psychology, like therapy, but I'm not going that deep into it. We're just really addressing what are the things emotionally that we need to address that are affecting your pain or your ability to recover from this physical thing that you're going through.
Yeah, and at least providing people an entry point, even if you need to refer to someone who has more expertise in a certain issue they're dealing with, then of course we refer out. But
Yeah.
like you said, some people, if there's even a whiff of emotion that's happening and you immediately tell them they have to go see somebody else, I mean, that's expensive. That's financially expensive. That's time expensive. It's really draining to have to feel like, well, so compartmentalized, like you said, like, well, I can only speak to her about this, and then I have to go speak to somebody else about this. It just feels overwhelming and exhausting and adds to our stress.
And I felt overwhelmed telling them, I'm sorry, can you go talk to someone about this? And I'd make all the recommendations. I'd do all the right things and check the boxes. Yes, I referred. And then follow up. Hey, did you ever reach out to someone? No. Then what? Then what do you do? So it was like, well, I'm not going to leave them hanging. I'm going to do what I can within my scope of practice. Obviously, if it was outside of my scope and outside of what I felt comfortable managing, then yeah, I'm going to send them to someone who can actually help them. But at least I've, as you said, created this entry point where, okay, I can introduce them to it. I can help them with this. And maybe that's all they need. How is that different from someone who has a pelvic floor dysfunction and they go online and find your YouTube video and now they don't need pelvic floor physical therapy? It's no
Right.
different.
Yeah.
So, what are some of the ways that you can help people within your scope of practice with these pelvic conditions that incorporate the mind and the spirit along with the body?
Yeah. Well, I do recommend for people who are interested, for providers out there or clinicians who are interested in kind of bringing more of this work in, to do something that makes them feel more comfortable with their own, because it's going to help you too. Like going through this stuff, the coursework, the trainings, even just reading some excellent books that are out there right now about embodiment tools, embodiment practices, um, various emotional and nervous system regulation techniques, things like that. Even just reading books can be helpful for yourself. And then you can begin embodying them in your own life and your own self. And from there, it's easier to help patients. But I love that you went through a hypnotherapy course. I went through a certified embodiment coaching course. So I learned how to really guide people through a process of learning to feel what's going on in their body. So I always tell people that I'm working with using embodiment tools, like a psychologist or a talk therapy in air quotes is going to process things with the mind. And here we're going to process things with our body. And so for me, that's a really nice way to help really define that I'm within my scope of practice, and also define that, I'm using tools that are different than another type of therapy might use. And so some tools that are embodiment practices and or some things that we would do is basically we help people identify their emotions. So we help them feel that they're notice when they're even feeling something. So many people just move through life. We got stuff to do. We don't have time for that, you know? So it's like realizing that we even have an emotion happening, have a feeling that is causing us some upset of some sort, some kind of unease. And then, so we identify that we have an emotion and then we embody it. So we discover where we feel it in our body. So we emote, we embody, and then we express it in some way. So we go through this process of, wow, what does it feel like? What does it look like? What does it sound like? If it could have a sound, what does it want us to make us move like? Like, how can we look at it, see it, experience it, allow it? Don't try to push it away or shove it under the rug, but also, ultimately, if it's not something helpful, don't let it be in the driver's seat either, right? Like, how can we let it be with us, but not take over us? And so learning how to process things through the body, through movement, breath, sound, those simple tools are really helpful. And it's not always a one and done thing. In fact, it's usually not. It takes, usually several sessions to really learn how to feel, because we have to learn how to feel again. I know that I was brought up in a household that was not about expressing emotions. And so this for me has been a path of my own that I've really, taken. And dance has been a big part of it for me. Dance has been an excellent way for me to express and feel my emotions and release them and really alchemize them so that they can turn into health and vitality rather than things that are just dragging me down. I mean, even anger, grief, fear, all of these things can be looked at, felt, and expressed in ways that all of a sudden brings a whole different sense to you. It's a sense of confidence, of pleasure, of power, do you know?
I can't nod my head anymore. Definitely all on the same page. And intuitively, that's what I learned how to do when I'm moving through my issues and learning how to feel emotions and what's going on in my body and I learned how to do that intuitively. And there was such reaffirmation for me when I went through the hypnotherapy training because it's very similar. You have to feel the feelings in your body and then get them out in a healthy way. Now in hypnotherapy, we're not dancing or doing anything like that, but that is how like a session might look like that with me, where it's like, okay, well, what is it that you need to do? Where do you feel it? And then I can recommend, okay, maybe you need to go for a run. Maybe you go outside and you just sort of swing your arms around or something, or do some sort of qigong, or, you have to find ways of moving that out of your body. Otherwise, it gets stuck because people fail to realize that emotions get stuck in the body and they manifest as physical things. And it sounds crazy to even say that, but it is reality. And there are so many studies and books and articles and there's so many things out there. It just takes a few clicks on the computer to really find some information. Everything you ever want to know is out there. It's just you have to know what to look for. And as a provider, I think it's doing a disservice to not even consider these things. And as a physical therapist, to really just be in the physical space. Like we cannot, because there's so much more to physical that makes up a person. The emotions are not physical, but they can manifest as something physical, but it's energy, as you said, energy in motion, right? It's energy, and we have to be energy workers, and we have to be mental health specialists, and we have to be these like we have to be all of the things. And
We are all of the
because
things.
we are,
Humans
right?
are all of the things. We are mind, body, spirit, energy. So, like, we are. And
Yeah.
we're treating humans. So, we have to treat them with the whole spectrum as well.
Important what you said too, that this takes practice. This isn't like a one and done. I'm a somatic experiencing practitioner, and it seems what you're doing, what Keneal is doing, it's all the same thing. We have to feel the emotion in our body, but it's not like we can just go and feel it once and then, okay, our pelvic pain might be gone. It might actually disappear for that session, even,
Yeah.
but it has to be a practice of continuing to feel our emotions.
Right, right, right. This whole conversation reminds me of a client who recently reached out and shared that she'd had terrible period pain. And if you think about that, if every month you just know that since you were a teenager, you've had period pain and you're now, let's say 40 or whatever, and like you're bracing for it every month, you're bracing for this pain, and then it comes and it hurts and you're bracing even more and it's stressful, and you're like, oh my gosh, why me? Why do I have to deal with this? Like, of course, I've many of us have been there. Like, there's so much emotion caught up in the uncertainty of, oh my gosh, when's it going to come? What's it going to interrupt this month? What am I going to have to cancel? What am I going to have to back out on, etc.? So there's a lot of just bracing and guarding and tension around the pain, which is a cycle. It gives more tension in your muscles, makes the pain worse. And so it's a cycle that, needs to be interrupted. But the key is that there's so many ways to do these practices that all three of us are talking about. There's so many paths to the same outcome. And I think you mentioned this, Camille, but like finding what works for you, it will be different for everybody. For me, dance is wonderful. For other people, they're like, no way. But for some people, it's a seated meditation just to calm the mind and body. But this one client who reached out to me was not one that seated meditation was going to work for. She was like, I can't be still. Stillness does not work for me. And a lot of that is due to a history of trauma that she has in her body, where it's, for her, in her situation, it didn't feel safe to be still. There's many, many reasons for that. But for her, what worked was this practice. She was like, I never thought that weird, crazy, wacko movements that make me look like I'm unhinged would work. But she's like, a regular practice of doing this every month, like on a consistent basis, a few times a week, would actually help cure her period pain. So she said that for the first time in her life, she's not having period pain because of, and she attributes it to a more consistent practice of moving her energy throughout the month. And that's helping to be more in touch with her body, trust her body more, and have tools to know what to do when things are feeling stuck and yucky. She knows how to move them through. And she's like, I don't look pretty. I'm not like, this does not look good. This looks crazy and weird, but it works. And I'm like, yes, you find your own path to what works for you. It's going to look different for everyone. And it's not overnight, and it doesn't always look pretty. In fact, I think it rarely looks pretty.
I don't think it's supposed to.
No.
And I shared with you earlier that one of the ways that helped me heal was dancing too. And I've had clients say to me all the time, I want to do exactly what you did to get better. And I say, no, it's not about that. It's about doing what's right for you to get
Right.
better.
Yeah. I actually have a new program coming out that has some dance exploration on it. It has basically where we're working on alchemizing emotions and using dance to do that. And so what I really want to make clear, though, when I release this, it's not quite ready yet, but when I release it, I want to make it really clear. This isn't a follow Brie type of set of steps. It's not choreographed. It's not like I have the right moves to show you what to do. I'm just providing a model of how you could do it, but it has to feel right for you. So yeah, I think there's guidelines we can give our clients, but everyone has to make it their own. And that's part of the practice itself. It's part of the healing right there.
I love that you're doing that, because that's something I've been wanting to offer, is like a movement practice that's more intuitive. But then because I don't want people doing what I do, and what I
Right.
do is right for my body, but what you do is going to be right for your body. Like, don't try to follow me, like do your own thing, but it's getting people out of their comfort zones to and allow themselves to be unhinged, like
Yeah.
as you mentioned, and to just do what your body wants to do, even if it looks crazy and ridiculous, and let go of the idea that people are judging you or it looks ridiculous. But just do what your body wants to do, because it's better than having that emotion stuck and trapped in your body and feeling yucky.
And sometimes it's just trying a lot of different modalities.
Yeah.
Like I teach multiple kinds of breath work, but if one doesn't resonate with you, it's okay. But give it
Yeah.
a try and see, because you might decide that you did have a real release doing that and your body did enjoy it. But
Mhm.
it's finding the right thing for you at the moment and letting your body decide, I liked that. I
Mhm.
want more.
Now, you brought up your program that you're releasing, but I'd like for you to share who exactly are you working with and how are you doing that?
Well, currently I work mostly online. So my business is mostly my online outreach through YouTube. So I have hundreds and hundreds and hundreds of free videos on YouTube. And so I don't really my clients in that sense of the word, I don't know who they are. They're the people who watch my videos. Then I do have online courses. I have one called Lift for prolapse relief and one called Overcome Pelvic Pain. And so those clients I definitely interact with a little bit more. We have some community aspect of those programs, and I have kind of my finger on the pulse of who I'm working with there. And some people I actually know a little more in depth through comments, through Zoom call, through various routes. So prolapse and pelvic pain patients, I would say, are the people that I've worked with so far, people who are dealing with these issues. My next program coming, it's not available yet, but coming soon, it's in the works, is for patients, if you will, people who are dealing with these issues, and also providers for people who work with these types of people. So maybe that would be, pelvic floor physical therapists. It could really be all sorts of different modalities, body workers of all sorts, people who are in, complementary and alternative medicine, various types of practitioners who work with women, because women often come with pelvic health issues, right? We know that this is very common. It's like, over 50% of women are going to have something going on with their pelvic health. So it's something that really any provider who works with women could deal with the challenges that I'm helping with. So such as pelvic organ prolapse, again, bladder leakage, pelvic pain, painful sex, things like that. So patients and providers are going to be looped into this next program, which is all going to be about mind, body, pelvic health. So it's an academy for people who are wanting to learn more about these connections and how to help themselves or help their patients. And so many of the providers are women who are dealing with these issues themselves too. So it's like they can help themselves while they're learning how to help their patients. I believe that we are all smart enough to be on the same page and to be on the same playing field. There doesn't need to be such a barrier between healthcare providers and patients. We can all be learning the same information, because frankly, we all need it. We all
Right.
need it. And we can always use refreshers too. Even if we know it, I think it can be really helpful to come with a beginner's mind and just take pieces that maybe are seen in a new way and can be used in your own life or with your patients in a new way as well.
And I just have a question for some of my clients, even out there, healing prolapse. Now, I have a bladder prolapse, and I believe that there is some sort of emotional component to it, even though once it happens, it is physical. I mean, I've seen it come out of my body. So I know it's there and it's physical, but I was just curious about the emotional component to it in healing as well.
Wow, I love this. I love this question. I love this topic. And yes, definitely an emotional component. When I first started really thinking about pelvic health in a more holistic way, it occurred to me, I don't know if I made this up myself or if I heard it somewhere. I don't know. But I remember being like, whoa, prolapse is an issue of too much pressure and not enough support. And of course, physically, it's pressure. Like there's pressure, intra-abdominal pressure, there's physical pressure, and not enough support from the tissues, from the muscles, from the ligaments that hold up the organs. So physically, it's an issue of too much pressure, not enough support, not knowing how to manage the pressure in your body, and not having the physical support from your structures. And there's also that emotional component of like pressure, like mental pressure, overwhelm, pressure in your life. As a new mom, when I developed prolapse, I remember that right around the time that I felt the drop and when I was out for a run, I had pressure because I didn't know what I was doing. As a brand new mom, I was totally overwhelmed, completely sleep deprived, doing it by myself with my husband, but really, not a lot of other support. And I remember making like 3 pies one day. I don't know what got into me, but I wanted to make apple pies and I made 3 of them. And then I went for a run, soon after and developed prolapse. There's so much pressure from this lifestyle that we all lead that's so fast. And we often don't have the support we need mentally, emotionally. So that too much pressure, not enough support, I think there's an element of that in prolapse. And also there's the element of once the prolapse develops, it's sensational. There is a sensation associated with it that's really bothersome. That feeling of like a golf ball in your vagina, very bothersome. And that often leads us to fixate on the sensation and fixate on the problem. Be scared, frankly, like put in a really simple terms, it's scary. And so then we go on Google and we look up, oh my gosh, prolapse, what is this? Because most of us aren't educated about prolapse or any of this. And so we go on Google and we look it up, and then we're scared. We're getting potentially conflicting information from our healthcare provider who might say, oh my gosh, this is the worst, you need surgery. Or they're saying, this is nothing, it's not a big deal, and blow you off. You can have both of those things happen with the same case of prolapse. And so there's a lot of conflicting information, a lot of fear, and that can lead to fixating on the prolapse even more, and more fear, more anxiety, more uncertainty, which leads to tension in your pelvic floor muscles, tension in the tissues that surround the prolapsed shifted organs, which makes things tighter and makes it more sensational, makes the sensations worse. And so then you've got more, again, these cycles are so vicious. And so it's really important to realize that these cycles do occur and to figure out a way to, I mean, I could talk about this for hours, but one simple way to put it is to almost, in a healthy way, learn how to have a healthy level of detachment from the issue so that you're, like, okay, this is here. There are tools that I can use to help manage the condition. There's things I can do. And then I release. I need to try to look at other things in my life that are going well besides constantly fixating on the prolapse, which is easier said than done. I'm totally aware, believe me, but I think that's one of the most helpful tools or helpful things that we can work toward with ourselves and with our clients.
That was a beautiful summary of all of that. And the idea that we need to accept and detach is pretty much the basis, I think, for any physical condition is accept where you are, detach from it because you are not your condition. You are not the prolapse, right? You are just experiencing prolapse because when you own a condition, you're basically saying, well, this is me now. You've subconsciously given up. There's no alternative. This is just how it is. But if you reframe it and think, this is something I experience, well, experiences don't last forever. It's temporary. And then you can move on from that in a healthy way, as you mentioned.
Yeah. And you're not broken. I mean, so many of my clients will say my vagina's broken or my body's broken. And it can feel that way. I don't want to minimize the bigness of these issues. And you're not broken. You're not broken. That's all there is to it.
One of the things you mentioned before and now too is the fear.
Yeah.
The fear of these symptoms happening, of when someone's going to have their menstrual cycle that month and tensing up for it, and the fear of the bladder prolapsing again, it creates even more of a cycle to continue. So if we can address the fear and almost normalize it.
Right. Normalizing is so neutralizing and normalizing are both so important without minimizing. So it's like neutralizing and normalizing without minimizing. Like we're not trying to say, again, this is not an element of like, oh, just brush it under the rug. Just pretend it's not there. It's not a big deal. That's not at all what we're saying, but it's just awareness and education about this cycle of fear and tension. And then everything we've just said, accepting, allowing, neutralizing, normalizing, finding other things to lift your spirits and think about and talk about and do, remembering that you're not broken, you're changed, but you're not broken. All of these things are so powerful. And since, tools like breath work and movement, dance, whatever it may be, getting back into a hobby you love, they're so seemingly insignificant, but they're very significant.
Very, very. Yeah, I totally agree. And I love that. And that's what makes this holistic and integrative
Yeah,
because we are holistic beings and we are, I mean, there's so many parts of us that integrate to make us who we are. Our way of treating has to model that. We have to model that in order to really get to the root cause and to really help people the way we want to, right? We are all in this space to help other people. We have to be open to helping in all the ways. And we have to be open to seeing all the ways in which dysfunction can occur and sort of bringing that all together. And you brought up an important point, both of you, that emotions are meant to be felt. It's not to say you'll never have fear again. You are going to have fear, but then you experience it, you be in that moment and then move on, right? We're not meant to stay in any emotion 100% of the time, even happiness. We're not supposed to be happy 100% of the time. We have to
right.
experience all the emotions. That's the
Mhm.
only way we can appreciate happiness, joy, love, is if we experience all the other things. It's just we get stuck in them. We
Mhm.
have to learn to move out and away from it.
Right. It's like riding the wave, not getting caught in the undertow. Yeah, and I love that. I think people are becoming more accepting and interested in the ancient healing arts that have been around forever, that were so holistic. They always were. It's like I believe that we all are channeling information from one fountain. That's the same. I believe people have been channeling information from one source forever. And the ancient wisdom of healing traditions like Ayurveda and other, healing practices are so wise and so balanced and so holistic. They're completely holistic. And thank goodness we're getting away from our more, modern medical model, which is completely reductionistic, like piecemeal, body part at a time approach. And we're beginning to reopen our eyes to what we've always known for thousands of years as people.
I think this is the pendulum. We start one way and then we swing too far and then we have to come back. Or it can look like a cycle. We start one place and then we add on other things, but at the end of the day, we always come back.
Right. Right.
We
Yeah.
always come back to where we are meant to be. And I am very grateful to be helping and assisting and, be part of this movement to moving back to wholeness, basically.
So we know that pelvic health has to do with the mind, the body, and the spirit, right?
Yeah.
But what about nutrition? What kind of role does nutrition play in pelvic health?
Oh gosh, that in my opinion, that has been a huge part of my personal journey is nutrition. I experienced a lifetime of abdominal pain and constipation and didn't realize until I was about 20, 21, around that time period, after a really traumatic relationship ended that was abusive, actually. And I do believe that the relationship I was in triggered my body to change. And what had always been an intolerance to gluten became full-blown celiac disease. And I have the genes, I have the genetic testing shows that I have the genetic profile for celiac, but I hadn't had such bad issues until after this relationship blew up, and I just really went downhill fast as far as digestive stuff and mood. I became very depressed, very depressed. Had to. So with that, I ended up discovering gluten even being an issue. This was a long time ago now. I'm 43, so this is 23 years ago. And you can imagine the world of gluten awareness has really shifted over the years. And so it was something I had never even heard of, but my mom discovered that she had a need to go gluten free. Obviously, it's, there's genes involved as well. So she discovered it for herself. And then she said, you might want to try this too. And I did. And it was not overnight. And granted, I was a young 20 something and I did not want to make these changes at all. It was very hard for me as a vegetarian who pretty much lived on bread and cheese to completely cut out gluten and dairy because that was also a sensitivity that I had. But when I did, it changed everything for me. When I finally kind of got the hang of how to eat for my body, not saying everyone needs to eat this way, but for my body, how to eat, it changed my mood. I became myself again. I felt more energetic. I could finally poop, huge deal. And I didn't have constant pain. But everything I just said there constipation or diarrhea, whatever it is, any type of digestive distress is going to cause potentially reflexive tension or holding tension in your pelvic floor muscles. So there's also straining, chronic straining if you have constipation, which can contribute to prolapse. And in many cases, that straining, your body will often react by kind of contracting reflexively. And so then you strain more and contract. Like, it's a very strange dysfunctional pattern that many of us develop. So the digestion definitely plays into pelvic floor health, but also pain. If you're constantly in pain in your belly, you're going to be tensing and tightening the pelvic muscles around the pain. And then if you also have mood issues, because we know our gut impacts our energy levels, of course, but also our mental health. And so if your mood and your energy levels are in the tanks, you won't care about caring for your pelvic floor or caring for your body the way that maybe you would normally like to. And so all of nutrition can impact your pelvic health, but it's all about finding what works for you because everyone's different. And I mean, for me, I had to go gluten-free and dairy-free and soy-free. And there was many iterations of finding the diet that worked for me. And really it came down for me to kind of cutting everything out and then slowly reintroducing certain foods. I still don't eat gluten ever, but I can now eat like goat cheese and sheep cheese and things like that. But everyone's different. And I think providing blanket statements such as eat more whole grains, even if they're gluten-free grains, or eat more beans. It's a good idea to eat real food, obviously, real unprocessed food, mostly plant, lots of plants, lots of good plants, and drink lots of fluid, water. But everyone will have different ethical and, reasons why they want to or don't want to eat meat, that kind of thing. I personally do, but not everyone does. And so you can't force someone. You have to meet someone where they are. And also, like for me, beans, lentils, I love them. They do not love my body. And so even though everyone can say, oh, you need that fiber, beans are so good for you, etc., they're not for me. And so it's like you just have to really do trial and error to find out what's going to work for you. But all of it feeds into your mental health, your emotional health, and your pelvic health.
So important that you said to do this yourself, figure out what's good for you, because giving up gluten for me didn't work.
Right.
Right.
Right. Exactly. I would never be like blanket statement, everyone needs to give up gluten. Not at all.
You have to try it out to see what works for your body because every body is different. So
Right.
you just have to go there. You just have to do your own investigation to find out. I'd love for you to share some more. You talked about your nutritional experience, but are there any personal experiences that you're willing to share that help to shape who you are and how you approach pelvic health and recovery? I'm talking about your retreats.
Yes, you mean the retreat that I went on. Yeah. I'm like,
Yeah,
I could take this in many different directions,
I
but thanks
know,
for
I
that
know.
hint. That's a good hint. And yeah, I'll just share briefly that I obviously I have lots of reasons to be interested for my clients, my profession, my personal history of prolapse, constipation, pelvic tension, all of these things, and really understanding that connection. When I'm stressed, I get more pelvic tension. I get like a knot in my perineum, like a golf ball that sometimes I'm like, oh my gosh, my prolapse is back, but it's just tension. And so all of these things definitely feed into my own personal experiences and passion for what I do. But I've really gotten into the energetics of being a woman, the lineage that I carry from my family of origin and from, generations, my mother, my grandmother, all of this. And I won't get too deep into it, but I went to a woman I took a retreat of my own and actually decided to work with a woman in San Diego, California, who really helped me dive deep into the wisdom of my womb and really helped me uncover all that's held in there energetically. So this is where it starts, some people will be like, this is sounding too woo-woo for me. And that's okay. I totally understand anyone who's like, no. However, your audience is, I'm sure, very open for anyone interested in going there. Whoa, there was so much stored inside. And during this release work, first of all, one thing that she helped me access was pleasure, which this is very taboo right now, what I'm about to say. And again, talking about like scope of practice and what physical therapists are comfortable with is for her, leading with pleasure was actually important. So the ability for her to spend plenty of time, not just go straight into a pelvic therapy session, but to actually spend time relaxing my whole body and then actually spending time getting the tissues of the labia hydrated and engorged, and then doing the internal work to really access my cervix, you know, the deepest layers and levels of my internal landscape. I'm telling you, what was released and what came through was so powerful. And it made me rethink the way I proceed when I do work with patients in person. Because I see some clients in person still. And so I think that, again, as a physical therapist in a clinical setting, you just don't have the time to really spend going into this deep type of ceremonial type of setting to really work with somebody. And I think that's a shame. I think that for anybody who's ready and open for this next step of healing work, it's so powerful to work with someone who can really spend their time working with you, getting your body ready for the deep internal work and really allowing yourself to feel safe enough so that you can feel these energetic things that are, for many of us, stuck in our womb and can release and just change everything. I mean, it was a journey. So I think that's the retreat you're referring to, but there's
That does sound like quite of a journey. And wow, that is crazy. And yeah, I can see how that would be, physical therapists would be like, can we do that? Are we supposed to do that? How does that?
it's edgy. And I mean, this person was a more of a body worker, not a physical therapist, somebody I very much trusted and had worked with online, spent time with her, getting to know her before our work together. But I think that it's not necessarily something physical therapists are going to introduce into their practice, maybe, nor should they, but just this concept and the awareness that I think when we medicalize pelvic care and just go in, quick exam, quick treatment, one and done, it's so invasive. It's such an invasive therapy.
It
And
can be really traumatizing for some people, even if they don't verbalize that,
right,
it can be really traumatizing.
right, right. And it's something that's made me question aspects of my profession. And so it's just not, it's something I'm sitting with, and something that I think that physical therapists in a very traditional setting, a clinical setting where they only have a shorter period of time and certainly aren't intending to really bring pleasure to their client. It's more for the therapeutic purpose, for the evaluation, assessment, maybe some manual therapy. That can be fine. However, I think there's a way to approach it that brings more nurturing, a little bit of a slower, gentler approach. I think there's lots of ways to approach it. And that's one thing that I'm going to be bringing into my new program, because I just think it's really important to continue to promote humanizing medical care, because so much of it is dehumanizing. I mean, I just got a pap smear and I was with a really excellent provider who I love. She's more of a natural medicine specialist, and still it felt quick. It felt a little dehumanizing, very clinical. And I just left kind of being like, okay, that was better than it could have been, but it still was, I think there's room for improvement.
I love that you brought up the whole, like, I don't know what stuck out for me, and now I have to ponder and journal on this is bringing ceremony healing, because I think healing traditionally has always been around ceremonies,
Right.
around rituals. And yes, in our society, we've sort of medicalized that and dehumanized. We've taken the person out of it, and they're just their disease, or just their illness, or just their foot, or just their pelvic floor. And we need to think about how we can bring ceremony back into the healing space. And I think we're all sort of doing it in our own way, or with the breath work, you with the embodiment, me with all the stuff too. We're learning how to bring more ceremony and rituals into this. And this is something personally that I am working with, is bringing more ceremony and ritual into my personal and daily life. And then how do I then bring that into the space of working with clients and with patients?
Yeah, I agree. And I think that what you just said is perfect, is what I was going to say, is is starting with yourself, I think, is the most important part. Some kind of daily devotional practice that allows you to get quiet. Maybe you open it and close it with something as simple as lighting a candle and blowing it out, or whatever works for you. But yeah, bringing more ceremony into our lives is important, more ritual.
I
Yeah.
agree with you both. And I'm not a physical therapist. And it's one thing I've been sharing with my clients a lot is just to bring connection to from ourselves to our pelvic floor
Yeah.
and sending it love
Yes.
and compassion. And having that next piece has really been a big part of my healing.
That in
Mm.
itself could be a ceremony or a ritual, is just taking some time throughout your day to focus on that area and send some love. Brie, I listened to your meditation that you had recently posted about it was period pain or a period
Oh,
meditation, and
yeah.
prayer that you did and like putting your hands on the womb and sending some love. I thought that was so beautiful. And I was like, wow, if we can do that every day, just like even if you're not having period pain, just send your womb space some love
Yeah.
for the day or wherever it is, like wherever calls your attention in that moment, right? Lie down and or sit down and just say where in my body needs attention right now, and just going there and sending some energy and light and all the woo-woo things or non-woo, whatever. Send
Mhm.
some stuff there to just acknowledge that part, because we fail to realize that we ourselves are a universe, right? We're made up of atoms, which are made up of, or which make up cells, which make up molecules, which make up tissues, which make up organs, with like it just keeps going. Like these individual parts of us work individually, but work together, and they make us this physical part of who we are. Like go inside and our cells, we have certain cells that like, wow, they really behave like these animals or these people because they're beings in themselves, and we have to acknowledge that and just send them some energy. Because imagine, we don't feel great when we go to work, say we're working for a corporate company and we're not appreciated as an employee. We make up the company, but we're not appreciated. But imagine if your bosses came down every day and just said, I love
Mm.
you, I appreciate you, thank you for doing the work that you do. Wouldn't you do better at your job?
I like
Right?
that. That's a great example.
So if
Yes.
we approach our body in that way, like parts of our body are employees, right? And we come down as the CEO and just show them some love and appreciation, they're gonna be a little happier to do the work for the day. Just my thought.
Mm.
Absolutely. No,
I
it's
love
it's a great thought and it's a practice that I've been doing every night now
it.
before I go to bed, putting my hand like right on my like almost right above my pubic bone and just sending that part of my body love. And I think it's a ritual that I'm going to keep up and I hope people listening will really hear what, we all said regarding that
Yeah.
and sending that part of your body compassion, love and appreciation.
Yeah, I heard I don't so our hands are very connected to our heart. And so putting your hands on your womb space, your vulva. I actually have a practice I call TYVD, touch your vulva daily.
Love it.
TYVD. Touch it daily. And again, it's like putting your hands on any space of your body, any part of your body is putting your heart on that part of your body and just sending it love. So yeah, really nice.
That's beautiful.
Mm.
I
Well,
really appreciate you being here, and this conversation has been magical, and we can talk for another three
I
hours.
know. I'm trying to cut myself off over and over because I could just keep going and I know there's a limit.
I
Yeah.
really appreciate you being there too, here too. And I know our listeners really appreciate it too, because you've shared a lot of knowledge and wisdom with everyone.
Oh, thank you.
Well, where can people find you?
So my everything that I have online right now is Vibrant Pelvic Health. So it's pretty easy. It's Vibrant Pelvic Health on YouTube and Instagram and Facebook, and my website, vibrantpelvichealth.com. I have a new website that's developing right now. It's not replacing Vibrant at all. Everything on Vibrant remains, is amazing. And there's just a new evolution that I want to showcase through briannegrogan.com. So I have some resources that people can sign up for on Brianne Grogan. The website is actually at this date, as of today's date, I'm not sure when this will release, but the website's currently under construction. But as of today, you can go to briannegrogan.com/challenge and get access to a 10-day mind body boot camp that's on YouTube, but you can get a portal that has all of the videos ad-free, which is kind of nice, in one place if you go to briannegrogan.com/challenge.
I love it. You're amazing. Thank you so much.
Thank you so much for having me. This has been so much fun.
Thank you for being here. We really appreciate it.
If you'd like to leave us a message or ask a question, please check the show notes with the link so you can reach us directly, or email us at beyondthepelvis@gmail.com.